Progressive familial intrahepatic cholestasis, also called PFIC, is a heterogeneous group of rare genetic diseases that affects about 1 in 50,000 newborns. This video deals with PFIC types 1, 2, and 3. Since the identification of these first three types of PFIC in 1998, many other types have been described. These more recent types are rarer and often less well understood. There is also a milder form of familial intrahepatic cholestasis very similar to PFIC called BRIC, benign recurrent intrahepatic cholestasis. BRIC is caused by the same defects as PFIC, but is characterized by a disease course with recurrent episodes, complete remission between episodes, and absence of progression to cirrhosis. PFIC is due to mutations in genes that encode proteins involved in bile secretion. Bile secretion depends on the transport of the main components of bile by specific proteins. Under normal conditions, these transporters are located on the surface of hepatocytes, liver cells, more specifically at the level of the bile canaliculus, which is the site of primary bile secretion. The mutations responsible for PFIC can affect these transporters at different levels. 1. At the level of expression, the mutation causes the absence of the transporter. 2. At the level of intracellular trafficking, the transport of the protein within the cell is impaired. 3. At the level of function, the protein does not allow secretion of bile components. 4. At the level of stability, the transporter is not localized at the right place long enough to play its role. Each type of PFIC can involve several levels of transporter alteration. The severity of the disease depends on the consequences of the mutations. This is referred to as genotype-phenotype correlation, particularly for PFIC2 and PFIC3. The chemical composition of bile is abnormal and bile flow is reduced, leading to cholestasis. Bile accumulates in the liver cells and damages them, which may lead to cirrhosis. Alteration of bile composition can also make it more toxic and promote the formation of lithiasis, gallstones that can obstruct the bile ducts, especially in PFIC3. How is PFIC inherited? PFIC is inherited in an autosomal recessive manner. Boys and girls can be affected, autosomal. A child develops PFIC when they inherit 2 mutated copies of the gene, one from each parent, recessive. A child is said to be a carrier when they inherit only 1 mutated copy of the gene, heterozygous. Heterozygous individuals, that is, each parent and possibly the siblings of a child with PFIC, may develop liver involvement. Women may develop cholestasis during pregnancy, intrahepatic cholestasis of pregnancy, or when taking oral contraceptives. For all heterozygous individuals, male or female, genetic counseling and a specialized medical evaluation are necessary to assess risks and screen for liver disease. Medical treatment and follow-up may sometimes be required. Types of PFIC. A genetic test on a blood sample makes it possible to diagnose the disease, PFIC, and to determine the type. It identifies the gene mutations. Parents must also be tested to confirm the child's diagnosis and to allow genetic counseling. PFIC1 and PFIC2 usually appear during the first months of life. PFIC3 may appear later in early childhood, during childhood, or even in early adulthood. PFIC1 affects the liver and other organs, including the digestive tract, pancreas, and inner ear. PFIC2 affects the liver, often severely and at an early stage, with a high risk of liver cancer or liver failure. PFIC3 is usually responsible for biliary cirrhosis with portal hypertension during childhood. It is associated with a high risk of liver lithiasis, gallstones. Liver symptoms and management. The symptoms of cholestasis are extremely intense and disabling itching called pruritus, linked to high concentrations of bile acids in the blood. Bile acids are the detergent components of bile. Pruritus disrupts sleep and causes behavioral and attention disorders. Scratch lesions can be extensive and stigmatizing. Different drugs are used to try to improve bile secretion or to reduce pruritus: ursodeoxycholic acid, rifampicin, and IBAT inhibitors. Before the availability of IBAT inhibitors and when other drugs were ineffective, surgery could be proposed to reduce bile acid levels in the blood, external biliary diversion. A piece of intestine is used to connect the gallbladder to the skin, stoma, with the aim of eliminating part of the bile, and therefore the bile acids it contains, into a pouch attached to the skin. Other symptoms observed in PFIC include jaundice, icterus, especially in newborns. It may be transient. Sometimes pale or even white stools. Impaired absorption of dietary fats and fat-soluble vitamins, which may lead to deficiencies in vitamins A, D, E and K. Growth delay, weight and height, and diarrhea, fatty stools or steatorrhea. Nutritional support is sometimes necessary, either by enriching the diet with sugars and fats that can be absorbed without bile acids, medium-chain triglycerides, or by using a nasogastric tube passing through the nose into the stomach to provide the required nutrients. In the vast majority of cases, the disease progresses to cirrhosis, possibly leading to portal hypertension and liver failure. A liver transplant is often necessary in patients with PFIC, most often during childhood. Transplantation becomes necessary because of severe pruritus resistant to treatment and/or decompensated cirrhosis or liver cancer. Children and adults with PFIC require lifelong medical follow-up, sometimes multidisciplinary, in a hospital program specialized in rare liver diseases. If newborn jaundice persists after 15 days of life, conjugated bilirubin must be measured. In case of newborn jaundice, it is essential to check the color of the stools. If the stools are not bright in color, it means they are discolored. Normal stools are bright in color. Abnormal stools are pale in color. In the newborn, jaundice plus discolored stools plus dark urine equals urgent medical consultation. A conjugated bilirubin test must be performed and a vitamin K injection may be necessary.